We have a number of questions about zero tolerance policies. Dr. Espelage, do you want to take this one and explain what zero tolerance policies are and why they are or are not recommended?
Right. So sometimes folks get confused about zero tolerance, right? We definitely want a zero tolerance, like we're not going to tolerate bullying. Bullying shouldn't happen here. But the ways in which, but that's one kind of definition, the layperson's definition. The way in which we think about it, zero tolerance is leads to suspensions, right? It's that punitive methods, when in fact bullying, we know, occurs when adults aren't around, and sometimes the story doesn't come out, but we know there's an incident, and there's a tendency for parents of kids that are being victimized to put great pressure on administrators, principals, to suspend kids. And they will cry zero tolerance. So what we do know is that taking that kind of approach does not reduce bullying in the schools, does not promote a positive school climate. What it does is it just kind of puts kids out on the street and puts them at risk for academic failure. If they're not in the classroom, they're not learning, so therefore they're at risk. And so the zero tolerance could actually happen both for those kids that are targets of victims of bullying, that in fact if folks didn't see it, and there's a policy at the school that we're not going to tolerate it, and we don't know the he said, she said, so we're just going to suspend you. So it can impact actually those kids that are victims that might be defending themselves, right? So zero tolerance, we know for a number of different reasons, is not effective for a number of problems that we have in the schools. We must think more preventative types of approaches to shift the school climate, to get kids in the seats in the classrooms, and not use an approach of like we will shut them out from school.
Great, thank you very much. And again, I'm going to apologize for not being able to get to all of your questions. Obviously, we have a lot, and we are doing our best to get to most of the questions, and as many questions as we can. There's a question here: do bullies in schools grow up to be bullies in the workplace?
I'll take. Yeah, you want to say that? Okay.
Go ahead.
Yeah, so there was a recent special issue of Criminal and Mental Health Behavior, and they show that there is an association in some studies between bullying and kind of job status and offending status. But do we know their behaviors within the context of the workplace more specifically? We absolutely do not. And we're getting closer to those types of studies as we, fund longitudinal studies, but, the workplace is a very different environment, so it's hard to know. If we believe that, in fact, bullying, the unique aspect of bullying is an aggressive behavior that includes power and a need for control and dominance, we could suspect that workplace environment may actually tap some of those behaviors, so there might be. But do we have the research? No, we do not.
Okay, great. So there's a question here about of the male and female teens that reported being bullied due to their looks or speech, did they say if the bullying was committed by people in their inner circle or people in their outer circle? In that specific study, they did not ask that question. We know generally that boys are more likely to bully other boys, and girls are actually more likely to be bullied by both girls and boys. But Dorothy, has any of your work looked at who the perpetrators were and their relationship with the victim?
Yeah, and so we do know some work out of UC Irvine has actually showed that sometimes it's a blending, right? So it could be within your friendship circle, but then it could be another clique as well. It tends to get more complicated depending on the structure of the school. So to say across the board, we don't know. But we also are becoming much more concerned about the cross-sex bullying that's occurring. Phil Rotkin's done some of that work at the University of Illinois, especially as it becomes more sexualized sexual harassment between boys and girls. But that's an excellent question.
We are approaching the 1:30 mark. Dr. Espelage or David, did you have any last comments or thoughts you wanted to make before I turned it back over to Dr. Wright?
No, thank you.
The last thing that I wanted to say, and I'm actually addressing this question now by text, is somebody who asked about inner city communities or low-income communities. And with that, I did a lot of the points were targeted at places where it's easier to create a program, but just to quickly address that point, with that, it's crucial to have a supportive school staff there because there are a lot of situations where parents are not supportive. And if you have a good school of staff there, even bringing in one of the programs that I discussed or building a coalition with other already existing organizations within the area can create a positive experience. And if they can do some sort of training to train the staff of that school or wherever, you're working, whether it be, I think this person cited a health clinic, if they're working at a health clinic or whatever the venue may be, if you bring in another organization to train those people, that can relate to a much more positive experience. And for that, more direct involvement is certainly needed depending on how bad the issue is. If you have to bring in somebody to do a seminar or to do direct workshops at the school in that situation, that might be better. But there are certainly programs targeted at low-income areas.
Great. Thank you so much, both to David Aponte and to Dr. Dorothy Espelage. And again, thank you very much to the Healthy People Office for hosting this webinar, and to all of you who took time out of your busy days to participate and sending questions as well. Dr. Wright?
Thank you, Marcia. And I want to thank all the participants for joining today's webinar. If you've not already done so, I invite you to respond to our closing evaluation poll on your experiences with today's webinar. We encourage you to complete the survey so that we can improve future webinars in our series. The poll appears in the upper right-hand side of your viewing screen. On behalf of the U.S. Department of Health and Human Services and its Office of Disease Prevention and Health Promotion, I'd like to express our sincere gratitude to today's presenters for sharing with us their expertise and insight. I'd also like to thank the Healthy People 2020 Injury and Violence Prevention topic area, Healthy People 2020 LGBT topic area, and the Healthy People 2020 Adolescent Health topic area for their contributions to the planning, implementation, and production of Healthy People 2020 and this important issue. We hope you'll join us for future Healthy People 2020 webinars. To receive notices about upcoming events, please sign up for our email announcements on the Healthy People website. That's www.healthypeople.gov.